First off, hello everyone. Thank you for joining today's information session on our Health Informatics Certificate. My name is Maddie, and I'm the Marketing Coordinator for Continuing Education at the University of Windsor. Before we begin, I'm just going to let everyone know that this will be recorded, and you will be sent a recording of this at the end of the session. So I'm just going to start the recording now. All of your mics and your cameras are off, so everything should be okay. I'm just going to start it now. Wonderful. Okay, and let's get moving. So as I said, this is a recorded session. You will have your recording sent to you at the end of the session. All your cameras and microphones are off and muted for the duration of the session. And as I mentioned previously, if you do have any questions that you think of throughout the session, just be sure to add them in the chat, and then we can read them off during the Q&A at the end. So before we begin, we'd like to acknowledge that the University of Windsor campus sits on the traditional territory of the Three Fires Confederacy of First Nations, which includes the Ojibwa, the Odawa, and the Potawatomi. We respect the long-standing relationship with First Nations people in this place in the 100-mile Windsor-Essex Peninsula and the Straits Les Detroits of Detroit. We at Continuing Education acknowledge the systemic oppression and generational trauma that impacts Indigenous communities today. We vow to learn about Indigenous history and complex systems of colonialism that have caused these traumas and result of influence as it relates to the world we live in today. We will then seek opportunities to raise awareness of the knowledge that we've gained through continued learning. I invite you to learn more about the University of Windsor's Indigenous initiatives by visiting www.uwindsor.ca/Indigenous peoples. So on the agenda today, we do have a couple things to review. We will be hearing from a few of our Winter 2025 Health Informatics instructors who will review our program, assessments, and future pathways after this program concludes. And then after the presentation, we will end the session with a Q&A as mentioned. And with that, I would like to introduce our wonderful instructors, Kim Ramirez and Dr. Deborah Dias, and I will now hand it over to Dr. Dias to kick off our presentation. So on to you, Dr. Dias.
To take my mic off there. Welcome, everyone. I believe this is the fourth offering, Kim. Is it the fourth one? We started this back whenever that was, and it was in response to the digitization of the healthcare system here in Windsor-Essex. And at that time, I was a full-time faculty member when we first started this. I am now retired, but I continue to teach this course as we need to continue to educate and get people ready for the work world that's out there now. Interestingly, when I was in the Faculty of Nursing, I really pushed to have an informatics course to be part of the curriculum. Hasn't happened yet, but the hospitals or wherever those that are informaticists, et cetera, working in the field, want to be part of this. The hospitals are telling us we need the people to be prepared to step into the job. So one of the first steps was for this course to be developed and to give you the start of what it is for health informatics. This is a beginning. It is certainly not the end of your education. And as this presentation goes on, we'll tell you how you can further go on in education, and Kim will be is more well-versed as far as what the future is with health informatics and job possibilities in that field. So the bottom line is, a lot of times we have a lot of terms out there about what health informatics is. We have, health management, health technology, we have AI, we have a lot of different things. So we just wanted to focus a little bit to give you a little bit more of an idea in case you're still kind of wavering or not real sure about what it's all about. So if you look at this picture right here. I'm just going to stop for 1 second. Maddie, is this being recorded? Because I still have the thing at the top that says this meeting was set to be recorded. Is it happening? It is, right? Okay, so
It
we can
should
get rid.
be.
Okay, so
Yeah, it
I'm
should be.
okay. I just wanted to X out that because it was covering my presentation here. So as you can see on the slide, health informatics is a globally recognized multidisciplinary field that combines the power of technology, data management, and healthcare to drive innovation in patient care and information management. That's a lot of words. So maybe to describe it a little bit better, it's the intersection, and you can see by this Venn diagram that health informatics is in the center. It's that intersection of information management and practices to better healthcare. Why do we have health informatics? We have it to improve the quality of care, to improve patient outcomes, and the paramount reason is safety in what we do with patients to bring them to their best quality of life. So the bottom line is that things like IT and information management systems classify data. Informatics takes that data from where it's stored, wherever that is, and we all hear about electronic health records and things like that, but there's many, many places that health information is stored. We take it from wherever it is stored and we analyze it, we evaluate it, we analyze it to develop information and create knowledge that at that point is then shared to improve patient outcomes. So it's that intersection of getting a hold of that data, what do we do with it, analyzing it, and then taking it out to a place where we can actually share it and do something about it. So can we go in the next slide then, Maddie, please? So who are our learners? I'm sure that all of you come from different places. Many of our learners are healthcare professionals. You do not have to be a nurse. You do not have to be a doctor. You do not have to be a pharmacist. What we're going to teach you in this course is very applicable to, we've had chemists, we've had engineers, we've had many different facets of life, business people that have been involved in it. And when we put the groups together, and you'll hear more and more about this later, when we put the groups together, we really try to mix it up so that there's a mix of expertise. So there's not all the nurses together or all the healthcare professionals. So you can see that there are IT leaders, there are IT technologists, there's computer scientists, there's a real variety of people involved in this course. Next slide, please. So we just want to give you a little bit about what the course is about. You probably will not remember much of this, but when the course is ready and set to go, the syllabus is posted online, and this is very much the information that you will see on the syllabus that comes together for your course. So it has 6 modules, 12 Saturdays. Each module is 2 days. And you can see what the structure is like there and what we teach. The module 1 is the fundamentals, et cetera, et cetera. And each slide that's coming is going to go into that a little bit more. So I'm not going to belabor that part. But upon completion, students receive a certificate in health informatics from the University of Windsor. Next slide, please. So the program format, it follows what Digital Health Canada wants us to give or prepare you for, so that you can go on for other certifications with Digital Health Canada. So since we are a Digital Health Canada continuing education provider, it means that we meet their standards for the Health Information Management Systems Society, that's what HIMSS is, and Digital Health Canada for curriculum quality and value. The modules were built parallel to Digital Health Canada's core competency modules. And our contact with Digital Health Canada is able to support our learners through evaluations and learning pathways as you potentially try to set a pathway for future education and movement through the health informatics field. Next one, Maddie, please. So the next 6 slides are all about the modules. I don't think I have to read them because you, I believe, will have this available to you on the website. But Kim and I teach the first 2 modules. Basically, in the first week, you're going to get about the healthcare system, because ironically, a lot of people that work in healthcare do not really understand how the healthcare system works. And that's very paramount into understanding how we might potentially want to change it or make it better. So we talk about, and it's ever changing. Any of you that kind of have your nose to the ground in healthcare know that things change between health teams and home care and what's going in the hospitals and program pathways and all this other kind of thing. So we try and give you the most updated reference for that and ideas so that you can work with it. So that's module 1. And then Kim comes in and talks very much about project management, and we'll tell you why that's important as we go through this presentation. Next one, Maddie, please. Then in module 2, you're going to have Dustin Reeves, who ironically, I taught at the university for 38 years in nursing, and Dustin was a student of mine back when he took his Bachelor of Science in Nursing. But he's gone on, and he is now a clinical consultant and an informaticist. If you go to the continuing education website for the University of Windsor, you can actually see a few videos there. There's one with me there. There's one with Dustin there. There's also one there with Leslie, who is also going to teach one of your modules. So anyway, Dustin will give you a basic clinical understanding about processes and how information flows through the healthcare systems, goes through electronic health records. He gives you a bit of an introduction to cybersecurity and blockchain, which are all things that you're going to come to know more and more about as each subsequent week progresses or module progresses. Next one, Maddie. This is Leslie Janice, and here in Windsor, if you're not from Windsor, we have basically 2 hospital systems. We have Windsor Regional Hospital, and there's 3 campuses actually involved with Windsor Regional Hospital, and we have Hotel du Grace Healthcare. So Kim very much works with Windsor Regional. She works with it all, but with the Windsor Regional side. And Leslie Janice actually is part of the Hotel du Grace Healthcare system. Again, we're working across the whole system with Transform. But some of the instructors are more attached to some of the different healthcare organizations here in the city. So Leslie will come on board and she'll help you to identify and define data types, basic medical terminology, requirements of various stakeholders, things like that. And as we go through these modules, and we'll say at the end or after I kind of review the modules with you, why each one of these modules is important, because each module is going to help you develop your own program management to help solve a real life issue in informatics and information management that are created for you. Next one, Maddie. Module 4 is taught by Saeed Samet from the School of Computer Science, and it is all about data analysis and evaluation. So as I spoke in the beginning about how we gather, informatics gathers all of that data from a variety of places. And then what happens is we analyze that data to create knowledge, and then for us to be able to then share it. So you can see in the program outcomes that we talk about, Saeed will talk about analyzing the data, effectively communicating that analysis, and providing data-driven recommendations. And also evaluation. Obviously, evaluation is huge. So it's a cyclical process where we assess and we develop a program, and then we put it out there and we do that. Then we implement that program, but evaluation is so important so that we know whether we need to bring it back reevaluate, change things, whatever it is. And for the nurses out there, that's called nursing process. So next one, Maddie. Module 5 talks about professionalism, privacy, and security. And Barb Kalazzi, I'm sorry, is from Health Information. She's a Health Information Management professional. This module very much will help to identify quality assurance, risk mitigation, privacy and security, issues with cybersecurity, understanding the basics and the fundamentals of protection of everything that we do. It's understanding Ontario's Personal Health Information Protection Act. So it's very much important. Obviously, that we do understand privacy safeguards. We develop privacy protocols as needed, and we make sure that we have quality assurance for that quality caregiving. So that's what Barb brings to us in Module 5. Next one, Maddie. In Module 6, we come back together. Kim and I come back together with you. And I said a couple times that each module builds on itself. Right from the very beginning, in the very first day that you're with me, you're broken into teams, and you will actually have actual scenarios that have either happened or are in the system right now that we need help with. Each team takes on one of these issues. And as you can see, as we've gone through the modules, it's built on understanding the healthcare system, understanding program management, understanding data terminology and data management, and then how do we analyze, how do we evaluate, and then how do we protect with that privacy. And moving that on into putting that together in a managed program to address the issue that you're given right from the beginning. So each module builds, and as each module passes, then the teams get together and they apply the information and the knowledge that you've gained within the modules to the specific issue that you have chosen. And then you develop that program management, that hopeful resolution to the problem or the issue that you've chosen, and you present it to the group. It's actually quite a fun day. We learn a lot. Kim and I say all the time that we learn from you each and every time that we teach this course, because you bring your own set of experiences and expertise to the program. And it's interesting to put all of the expertise from the different areas together and see what you come up with. And then some of the solutions that have come around have been very viable and very useful. And so we hope that that will come for you as well. And so that's what happens. You gain the knowledge, you apply it to your issue or your problem that we present to you, that you choose, and then hopefully we come together in the end. And it's a sharing of ideas. At that point in Module 6, when the presenters present, it's a sharing of the ideas with everybody. So, saying, well, did you think about this? Or did you think about that? Or that was great. I would have never thought about that. So it's a very interesting thing. And then Kim goes on to then talk more about the program management and systems implementation. So the next slide, Maddie. I don't know, Kim, if you want to take over, or Kim,
sure.
Yeah, if you want to take over now.
Sure.
Okay.
So as part of the certificate program, there is obviously an assessment process that we follow. So there is a quiz, one quiz per module, and everybody is required to complete it, and you're required to get 100%. You can take it repeatedly until you achieve it, but this is just a way for us to, confirm that the information that we're presenting is actually being digested and integrated into the group work. That is the next piece. So there is a group project. We assign the groups, and as Deb alluded to earlier, we try to mix and match the different backgrounds of all of the participants to ensure you get a bit of a cross coverage as part of those groups. And then there are some evaluations that the group members do to evaluate each other on their participation in the group, peer group evaluation. The final presentation, so there's two pieces. There's a group charter that is a written document, that is a document that is submitted, and that group charter needs to be completed together and submitted. And then there is a group presentation on that final day of the course, with some kind of a PowerPoint or etc., to present the overview of what you have in your project charter. And so those presentations are intended to be approximately 15-20 minutes at the most. And we do take a look and we monitor the timing of it, and that is part of it as well. So the group charter, the submission, is approximately 2 pages in length. It has a ton of information in it that you will be working on and adding to throughout the course duration. So every module you will learn something, and you will take that information and apply it into your group charter. So the group charter is an iterative type document that you'll be starting in, roughly week 1 and continuing to add to and improve it upon it throughout the duration based on the content of what you're learning in each of the modules along the way. There is no textbook, but there are some suggested readings that we'll post just to add some additional learning opportunities for folks, to get you information about what's going on out there in the real world, and, some examples of what we are covering in the modules and whatnot. So that covers off sort of the full assessment overview. Next slide. So and I don't know if I was going over this or if Maddie was going over this, but I'm happy to do it. There are some requirements, and you, as a student, you cannot miss more than 1 day per module, and you can't miss more than 2 days from the course. So you can't miss an entire weekend of the course. You could miss 1 day if something in life comes up. However, you can't miss both, and you can't miss more than 2 of those days across the duration. We record the classes, and I said we make every attempt, because once in a while we forget. So sometimes they start a little late, but we do everything we can to record the classes, and then they can be provided to you for your review. They're not meant to replace the attendance in the class. Also, any course materials, any recordings without the express permission, you can't do. So we will use our platform that the continuing ed folks use, is where you will get all of the information that's required, and that is where it should stay. So essentially, to successfully pass this course, you need to attend each class, and you need to attend the final presentation day. That is a group presentation, so all members of the group need to be there for that presentation. Participate in the class discussions and the group sessions. Successfully complete all of the quizzes and the assignments, submit your peer group evaluations, receive a positive peer group evaluation, and of course contribute to the final group assignment. So there is no, the grading for this is either complete or incomplete, but again, it's based on all of those requirements. Next slide. So from a future pathways perspective, this field is rampant right now. There is so much activity. There is across the province, across the country, and for that matter, across the world. But we're seeing it significantly in the province right now. I think if you are okay with travel, you could work anywhere. There is absolutely opportunities. Primarily in our region, We are working on expansion of our current HIS, or our current systems that are shared within the region. We just recently expanded to include the Sarnia Hospital on our instance of the Oracle platform. So our health information system that we have in the Windsor area, well, actually, so Windsor, Leamington, Chatham, and now Sarnia, is an Oracle platform. We just expanded it into Sarnia. It's the step one. We are doing something called a health information exchange and supporting that on behalf of the province. We are talking about patient portal implementations. We are talking about further integrations with community solutions. There's just so much on the horizon. Once you get sort of into that first level of digitization, then the doors open. We are working with an Oracle collaborative in the province on a number of initiatives that are happening at the provincial level, things around the Indigenous populations and improving the data quality related to Indigenous populations, improving the care pathways that are followed for them, and improving their experience within our acute care hospitals, for instance. So there's a number of these job opportunities related to all of these initiatives that are ongoing. The skill set, we are still challenged with finding folks that have a skill set where they can easily sort of step in and just hit the ground running, because there is just not enough people with the education in the space of informatics. We are progressing in this region for sure into something called a HIMSS Level 7. We are going to try to get certified at HIMSS Level 7, which is essentially an evaluation of how digital you are. And the HIMSS Level 7 requirement is now that we need to start processing data and showing how that data is changing the way we deliver care within the region. And so it's not just about the system working well to support clinicians and patients. It's also about the system using that data to further then influence how we deliver care to improve that, that care delivery on behalf of patients. So there has been that's sort of in the health informatics space. The very interesting thing about health informatics is it is very broad. So you can work in health information management, which is sort of in that space of health records type of things. You can work in what I call clinical informatics, and that's the translation of how digital systems and workflows connect, right? How do the clinical people talk to the IT people, essentially? So that's what I would call clinical informatics. You can get involved in business analysis, requirements gathering for new initiatives. You can get involved in application support because there's always a front end to an application that needs an interpretation by an end user who actually knows something about the back end as well. So I think there is, a vast set of opportunities out there as it relates to health informatics, because we just can't fill the positions that are out there. So this is a quote from one of our prior health informatics students. So the Health Informatics Certification bridged my career gap, merging IT expertise with healthcare, opening doors to Evolve Phase 4 and igniting my passion for data analysis in a meaningful new path. So this gal is somebody that was working on our expansion project to the Sarnia site. So that Evolve Phase 4, that's what that references. Again, it's very vast. So you can see some job titles that are listed there because there's just so many. There's no set health informatics role. There are many roles that require a health informatics background or skill set. So you can see a list of them there. And then the forecast, of course, it is ever growing. Next slide.
Yeah, so I'll hop back in. if everyone can hear and see me. Thank you to Deborah and Kim for your insight on our programming. And at this time, I'm just gonna take back over to chat a little bit about our program, specifically key dates and fees. So, diving right in, our learning will run from February 1st to May 31st on Saturdays from 9 a.m. to 4 p.m. Eastern Standard Time, as I believe Deborah mentioned earlier. Please note that there will be a few weekends that we will skip over due to holidays. So just keep those in mind. And if you are interested in learning what those weekends might be sure to check out the full schedule on our website. Moving right along, so the fees for this course will be $2,100 plus HST. Payment plans and discounts are available, so be sure to contact us for more information. More specifically, the discounts are applied to, people who are associated with the UWindsor community, specifically if you are, a previous student or if you're a current student. Those are kind of the discounts that we have available. Please also note that the registration deadline is January 28th, and our program is over halfway full at this time. So if you are interested in securing your seat, I would recommend doing so sooner than later. And with that, I'd like to thank everyone for joining us, and thank you to both of our wonderful instructors for a very informative information session. So now we can take some questions from the group. Again, be sure to write them in the chat, and then I can state them out loud. I know that we have one that came in a bit earlier. So the first question we have is a question about the job opportunities in this program. So does this program offer placement, confirmed placement, or any bridging opportunities for potential industries like hospitals, the private sector, and so forth, Canada-wide? Or is it only limited chance focusing to Ontario province only? Kim, I know you spoke a little bit about the employment opportunities, so maybe if you want to speak to that.
So the employment opportunities are across the country, across the world even. So let's be clear, we don't provide confirmed placement. That is not something that we offer as part of this, but the content of what you would be learning here is Canada-wide. We talk about the Canadian health system, we don't talk about the American system, but a lot of the other principles, project management, data analysis, all of those things, they would apply regardless of the country that you're in. We focus on the Oracle EMR somewhat, or the Oracle HIS somewhat, but again, a lot of the principles that we cover would be appropriate for any kind of a health information system, whether it be a different vendor or whether it be a smaller one, even in a primary care physician's office, for instance. The principles are the same. Data is data, no matter where it is. End user experience is end user experience, regardless of where it is. But we do cover specifically the Canadian healthcare. And so some of the data examples that we would talk about would be more relevant in the Canadian market than they would be in perhaps a different market. Does that answer the question? I think it does.
Ironically, if I can just add a little bit to this about students that have been in the class, we were contacted a couple sessions ago from many people out on the West Coast because nothing like this was available to them. So we've had many students from across Canada. We've even had students that chime in for the courses, and they've been in different time zones in Europe for this. So it's interesting where the students come from, which can cause some issues when you're working with your group work. But that's all part of team management that we're trying to teach you, that you have to make sure that you work well together when you're trying to develop a program of management or a project charter. And those are things that we're going to teach you about. So it's just interesting that I've seen in the chat as questions have gone by, is this for international students? It's for anyone who wants to be involved or learn more about health information management and health informatics.
Yeah, wonderful. Really great answers. Thank you, you two. The next question we have, which Deborah, you kind of covered this. Is this program also for international students? I think you pretty well covered that. We're seeing people from, many different areas in Canada, people, as you mentioned, in Europe coming and taking part in this program. So while it is focused on the Ontario healthcare system and the Canadian system kind of as a whole, by the sounds of what you mentioned, Kim, this can be, cross-applied to many different systems around the world, because this is an ever-evolving field for many areas, many hospital systems. The next question, how is the certificate program different from the core modules offered by Digital Health Canada directly? Looking to understand value of the certificate in terms of work opportunities, HIMSS credits, etc. Yeah, if one of you two want to speak to that, maybe.
Yeah, I can talk about the digital health informatics core. They're similar. This is a little bit more extensive, and you get the hands-on activity with the group. If I remember correctly, the core modules is a self-directed learning, roughly 14 hours of time commitment, if I remember correctly. It's been a while since I looked at it, so but this allows you to actually apply some of what you're learning in association with the project that you're doing with your group work. So from a content perspective, similar. I've never compared it module by module, but similar.
Great, thank you. The next question I'm seeing is, I live in Northern Ontario, and I was wondering if you know if there are a lot of remote opportunities with some travel.
Yeah, so the topic of remote is coming up more and more, and so I can't speak specifically to the north because I'm not aware of a particular project that's in the works right now in Northern Ontario. I can speak to sort of the Kingston area and as well as the Niagara area, as well as Nova Scotia. So all of those three areas have done recent implementations, Oracle implementations, and they had a significant complement of remote resources. It speaks to a couple of things. It speaks to we can't get the resources in the region where we need them. So, being an on-site resource is getting very challenging to recruit. And so we are learning how to work in project work more effectively from a remote perspective with, to your point, some key times where you might have to travel for some key project activities, go live, for instance. And I can tell you that the Kingston project, the Niagara project, and the Nova Scotia projects are all employing remote resources with, again, some level of travel, but primarily remote work. I can't speak to the north specifically because I can't think of an actual project that's going on right now in Northern Ontario, but it wouldn't surprise me if there was one coming along. And it sort of depends on where in Ontario. I think that there's an initiative perhaps coming in the Owen Sound area. Yeah, there's just opportunities all over the place.
And one of the other things I'm involved with is a VON, which is a Victorian Order of Nurses here in Windsor. I actually worked for them for a number of years. And ironically, when Kim mentions Nova Scotia has a new digitizing project with VON Canada, and that has a timeline to eventually reach Windsor and Ontario. So while the project has started in Nova Scotia, it's going to have far-reaching effects and will be implemented in Ontario as supposedly starting in the spring of 2020. I can't believe it's 2025, in the spring of 2025. And so the people that have been involved in that project have worked remotely with Nova Scotia. But then when Kim mentions things like go live, that's when the whole implementation project goes live to be a working entity in wherever it's at. I think one of the things that we have to understand is while there are companies called Transform, there are other companies out there as well. that all deal with informatics. And I think one of the biggest things that we have to understand, we get the question a lot about, well, is this just a short-lived thing? You know, will this go away in 5 years or 10 years? This isn't going away. This is something that is here to stay. And we have to deal with it. It's funny, you know, a lot of the students will say, well, why digitize? Like, why? And we go back to the things that I said at the beginning of this presentation, where it's quality of care. It's the quality of care for positive patient outcomes. It's the safety of care, the safety of implementation programs for patients in the future, with better quality and better outcomes. So that whole thing obviously is something that's not going to go away. It's only going to progress as time goes on. And digitizing and health informatics, health information management, health information exchange, all of those are part of what we need in order to get to that next step.
Great. Those were really fantastic answers. Thank you, you both. Next question I am seeing is if you could both, or if either of you could think of some work projects, notable accomplishments of the alumni of this program. I know, Kim, you work with one of our alumni directly. So maybe you could mention, you know, what kind of projects they might be working on right now.
Yeah, I've had a couple actually that have come through on short-term placements, and one of them was on the Evolve Phase 4. So they functioned as what I would call a junior business analyst / program assistant on a particular work stream. So I believe she was on the emergency room work stream as we were implementing the Oracle solution in Sarnia. Her focus was on the ED space. Along with a work stream lead. So the two paired together to be able to do all of the things that need to be done in order to implement the new system into the emergency department.
Great. That sounds fantastic. If you guys have, you know, any more questions about our alumni or maybe comments about this course, you can reach out to continue@uwindsor.ca, and I can maybe look up some more information to supplement your understanding of what our alumni have said. So next question, I'm seeing BCIT has a digital health certificate. How does this certificate compare to that? So we would have to look a little bit more closely at our certificate versus theirs. So Pooja, I can contact you after the session, or if you want to email us and ask that question more specifically, I can probably provide a bit more of a breakdown on how our two programs differ, because I don't think Kim and Deborah would probably have the exact information to provide at this moment.
It's just interesting that it was initiated by the nursing faculty. And back when this program started, Transform actually went to the college and the university and wanted a program developed to be able to get people to the level they needed to be able to understand what was happening in our own community, kind of thing. So when it first started, managers and leaders within the hospital were the forthcoming people that came forward with this project because they had no background, kind of thing. So it was the nursing faculty, and I saw that came up from BCIT. But I had mentioned that someone had contacted us before, and at the time they contacted us, there was nothing available out there that was similar to what we were offering. That was similar to, so Maddie's right. We would really have to look into what their digital health certificate was offering to be able to tell you the differences. And at this point, we don't know. I don't know what that is.
Mm-hmm. Okay, so the next question I'm seeing, do you have any contact with maybe some of our alumni from Western Canada who are working now after graduating from this program? So maybe if you two have any contacts that you might know of, not off the top of your heads, that's okay. So if you guys can think of anyone, let us know. But Kim, sorry, not Kim, Deborah, were you about to say something?
I was just going to say, I think maybe continuing ed might have, if anybody would have had, maybe, I don't know if Sula may have knowledge of anybody that maybe went on, you know, because one of the things that we talk about towards the end of the program as well is, and I've seen some of the questions kind of pass by in the chat about, you know, next steps, and we talk about next steps if you want to get more into like getting a degree in informatics or something like that. In fact, some of the other instructors, like Dustin Reeves, has gone on. He got a BSCN and then he went on to get a master's, I believe, in informatics. So Dustin would be a really good person to talk to about next steps, as well as I know continuing ed does bring the information forward for the group of students that comes to the program as to what the next steps are in order to get further certification that is recognized by those that you may apply for a job.
Absolutely, and I can speak to that. So after the program, if you are interested, we do have a contact at Continuing Education. We work with Digital Health Canada, and if you are interested in, you know, going forward to get your health informatics certification with them, we can connect you with our contact, and they'll be able to help you understand, you know, what the next steps might be, as well as how you can, you know, translate your experience to, you know, potentially taking that exam and being successful. So what types of learning do you need to, you know, supplement with in order to be successful to take those exams? So if you are interested in understanding, you know, the next steps with DHC specifically, please contact us at continue@uwindsor.ca and we can set you up with their contact information so you can coordinate more information with them. More information in terms of questions. The time commitment for this course is only weekend time commitment. If it's only weekends, how many hours commitment each weekend? So this program does run on Saturdays from 9 a.m. Eastern Standard Time to 4 p.m. So please note that is the schedule each week. And again, as I mentioned earlier in the presentation, there are some weeks that are skipped because of holidays. So if you are looking for the more specific time breakdown, please visit our website and our registration page. It gives more specific details on that, the times that are running for the course.
As part of those Saturday sessions, we provide time for the groups to connect and work on their projects. I think it's important to note, though, that some of the groups in the past have decided to skip that time on Saturdays and they meet a different evening or a different day of the week. So, but that is something that would be agreed upon by all members of the group. The commitment from our perspective is that 9 to 4, the last couple of hours of every Saturday are to provide you time to meet as a group in order to progress your group work.
Great. That's great to know. The next question. Are there any other sessions offered besides the start in February? So at this time, no, we only have our health informatics program running in the winter term because it is pretty lengthy. So we do have, of course, this session starting this February, and the next session wouldn't start until next February or whatever time, you know, is scheduled for the 2026 session. In order to work as a health informatics nurse, is there other recommended courses that are, you know, recommended after this course? So as I said, if you contact us at continue@uwindsor.ca, we'll be able to provide you more information specifically with Digital Health Canada to help you figure out, you know, what the next steps are or what they would look like after this course. They'll be able to give you a bit more insight into, you know, what those larger, you know, certifications for health informatics nurse might look like. Next question, will you share the recording with the participants? Yep, all the recordings will be shared with participants. It will also be posted on our website before the end of the week, I'm hoping. So keep your eyes out for that. I will be sharing more information there. Do I need to be a science student or nurse before I study health informatics?
No, but I think it's key, like, I mean, recognizing that you will maybe have to do a little bit more work on your own part to be able to ensure that you're there, right? So if you know absolutely nothing about the healthcare system, we're going to try to teach it to you. But the folks in your group that come from healthcare are the ones that would fill in that gap for you. If you, are from healthcare but have no knowledge of IT, then we would pair up in the group to cover both of those things. The intention to be successful in this is that you pay attention, that you attend all of the classes, and we will give you the information that you need. If you want a little more, you may have to do a little bit more work on your own, but no, you don't need to be either of those to be able to take this certificate. And that's what this is intended, to start people understanding what health informatics is about and determine whether or not you might be interested in certain veins of health informatics. This is the overall, this is the intro, and then you can maybe determine which one do you like? What do you want to be when you grow up?
Great answer, Kim. And I think that speaks to another one of the questions. One of the other students asked, what's the benefit of completing the certificate versus a master's in health informatics? As you kind of covered, this gives a lot more of an introductory, focus onto it. It lets you investigate some of the streams of health informatics in order to see, where you want to go in the future, what specifically you want to specialize in. It also, compared to a master's degree, those can be quite expensive and quite long. This is a condensed, intense learning opportunity, which will get you, those first steps into this field. So that's kind of the difference between the master's and this program.
I think as an employer, it's important also to note that the master's doesn't necessarily add your ability to be able to jump in and start working. So I think it's the commitment, to Maddie's point, is significant for the master's, but from an employer perspective, it doesn't necessarily change whether or not you're employable, if that makes sense. At least out of the gate. If you want to do leadership in informatics, then the master's probably does have a different sway from an employability perspective. But working in health informatics, I would say that it does.
Okay. The next question I am seeing, can students in Windsor get the opportunity to shadow informatics roles in the hospitals? I know we mentioned this a bit earlier, but we don't directly have a channel that directs to placements. I'm not sure if there's any, placement opportunities. Kim or Deborah, maybe you could speak to that if you know of any placement opportunities in the region.
So at this point, there isn't. We have had some conversations about perhaps getting some hands, like, I don't want to call it on the job, field trip type opportunities, either within the region or within Transform, but we haven't progressed any of that at this point in time, especially since our population that takes the courses is now across Canada. It's difficult for them to attend a field trip, right? So that is not something that we offer as part of this certificate program at this time.
Okay, thank you. One of the last questions I'm seeing, will you give a degree after completing this course? No, so this is not a degree program. If you are looking for a degree, I do recommend you look more at our, academic side to things. Look at undergraduate, graduate programs. This is not a degree program. At the end, students will receive a certificate from the University of Windsor, but it does not equate to, like a graduate level master's degree or anything. Let me just go through to make sure nothing is missed. Okay. Is there some kind of standardization certification exam for health information management other than the certificate received from this course? From my understanding, I know that you two could probably speak to it as well. Digital Health Canada does provide that standard certificate, which is recognized across Canada. That's, the partner that we work with as well. Kim, Deborah, I don't know if there's any other certifications that might apply in this case.
I thought that, you know what, I don't want to speak completely out of turn, but I think it's a follow-up with Sula, because there is something that she was working on with the CPHIMS or one of those others to get the certification. It doesn't give it to you, but it allows you to write it or something along those lines. So
Okay.
we should get that information and provide it separately.
Wonderful. Yep. So just for everyone's reference, Sula is our academic lead here at Continuing Education. She wasn't able to join us today, but for more information again on, what kind of opportunities there are, we can definitely answer your questions in that Continue inbox that I've mentioned, and we can tag in Sula to offer some support and answer some questions as well. Is PEI using this technology?
So
Do either of you know?
So PEI, they have health information systems there. They're not on a single instance that I'm aware of. I think Nova Scotia is the first of the East provinces to go that route. That's not to say that they're not going to, but hospitals in PEI absolutely are using health information systems.
Wonderful. Sorry, I'm seeing a bunch of messages right now, so I'm getting a lot of notifications. Yes, I can provide Sula's email. I will be sending a follow-up email anyways after the session, so I can include her in that if you have any further questions directly for her. Is this a post-graduation diploma or extended education certification? So this is categorized under continuing education. So we would say that if you have a degree already and if you want to, continue and explore into health informatics, this is a great opportunity to, kick off that learning. But this is not technically considered, a post-graduation diploma. It very much is, that first step in learning towards, the career that you want in health informatics and, what pathway that might be. Yeah, so that's also, I think that's all the questions that I'm seeing right now. Does anyone have any last minute questions? We have, I think, 3 minutes left in the session. Nothing. Okay, sounds great. Oh, Gloria, I see your hands raised. How many of the students that have completed this program have been employed? So Gloria, I don't think we have an exact number on hand right now. We would have to survey a bunch of our, previous students, but that is something that I can look into and possibly explore further. As Kim mentioned, there have been many students that she's worked with directly. So we do see a lot of students coming out of this program and finding really, really great routes into health informatics. So I can say that for now, but I would have to dig a little deeper to find out the exact number. Where are the other ones? Are there any eligibility requirements? Yes, so on our website, you will see a prerequisites tab. So if you just explore that, you'll be able to see that we do expect you to have, basic computer skills, experience working with word processing, examples like email, web browsing, knowledge in statistics and mathematical literacy equivalent to grade 12. And then a post-secondary education in a health-related or business field is strongly recommended. Again, it does give some context, but, as Kim and Deborah both mentioned, there are people coming to us from, many different backgrounds. So the groups will help fill in some information for you as well. And last question that I'm seeing, can one get a job with the certification as a registered nurse in Canada? As we've mentioned, there are lots of job paths after this certification, whether you want to go on for, a higher degree with it, you found a channel that you like in health informatics, or if you, simply want to continue on with maybe a certificate with Digital Health Canada, there are lots of different avenues and pathways, and that's something that our contacts and Sula can help you investigate a little further.
I think if I can add a little bit to that, as far as registered nurses, when this whole process started here in Windsor, Essex, and I can speak to it here, what happened was it was all of the managers of all of the floors that came together for many, 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 many meetings. of preparation, and they became the leaders that took the information back to the staff that was working on the floors. They became the ones, the go-to people when the whole system was go live. And so were the nurses important? Absolutely. And that's why I said previously, I would really like to see an informatics or health information management course being necessary in the education of nurses going forward, because they have to have these skills going forward. It's going to become a requirement in nursing. It hasn't happened yet, but down the road, that would be my hope that would happen. So in answer to your question, can you get a job with this certification as registered nurse in Canada? Again, Kim's alluded to many, many, many jobs. Does it go hand in hand? Absolutely. If you have a certificate like this and you go to a hospital that's implementing or digitizing or, has that program going and, whatever, that may open doors for you. Absolutely, kind of thing. So.
In comparison to somebody who doesn't have it, absolutely.
Yeah.
Great. Thank you both for, adding to that. And I think with that, we're going to end the session. We're right at 1 o'clock, so just on time. Thank you all for joining us. As I mentioned, you will be receiving this recording and the email to follow up. But I appreciate you guys taking the time out of your day to come join us. And if you have any, questions that you weren't able to ask, be sure to send an email to continue@uwindsor.ca and we can look into figuring out some answers for you. Have a great day, everyone.